Hey everyone. So I've been saying for the last year that I was going to make that one video on public health, and I realized that this is a crazy time to be talking about public health. And that's what's made this video take a year, is because it's hard for me to convey the importance while also reducing it down into something that you'd be willing to listen to, that's not going to ramble on, because there are so many different complex ways that you can approach the subject, and obviously it's a complex subject that is interdisciplinary as well, that comes with its own challenges. I'd say the easiest way to navigate those challenges is by just starting a dialogue about what public health is for me and what makes me passionate about it, and how it might be meaningful for you if you understand how it applies to your life and why it matters. So, what is public health? So, public health is the science, art, practice of policy making and ensuring health promotion and risk reduction in regards to health and quality of life. So one would ask, what is health? And then health is not merely the state or of it's not merely the absence of infirmity, but a state of complete, like, mental, emotional, spiritual, physical, psychological well-being. So it's everything put together, and so health can't be separated from the other aspects of health. So another big important thing are the social determinants of health. So social determinants of health, big vocabulary word for public health. So basically there are determinants of health, and then there are social determinants of health. So determinants of health are largely things we don't have very much control over. We do have control over them in the way of science allows us to do more, but we don't have control in the way of, you can't control your genetics, but you can control your behavior, but you can't control your geographical environment, but you might be able to control the factors in your immediate vicinity. Or you might have a good job, but you have expensive, like a high deductible insurance policy that makes access to healthcare a challenge. So the social determinants of health look at how those different factors work together, and really focuses on those socio-cultural challenges. So any difference in health outcomes that are preventable are referred to as disparities, and the opposite of disparities would be equity. My cat opened the door. So health equity is the idea that everyone has access to what they need for them to thrive. So it's not equality, which would be everyone receiving the same thing, it's or having access to the same things. It's equity, which acknowledges the fact that not everyone is starting from the same place. So saying that they have access to the same resources isn't necessarily true, because it's not taking into account the whole picture. So there we have it, right? Equity. I think that is the big thing that public health focuses on, and I think it's something we should champion, and I don't think it's a word that we should let go to rest. I think equity is valuable, and it's something that we should be using more. It's something we should be thinking more about. We should be thinking about how we can implement equity in our relationships and in the way we interact with the world, giving to ourselves and giving to others. So those are just some things to think about. I've been letting this video stress me out for a year, and I just decided I wanted to record something. So that way I can say I made this one video, and maybe it'll make space for me to create another video that's not this one, because this one has been a burden to me. and I haven't been able to quite move past it until I just do it. So this is me doing it. It's not amazing. Maybe it's not the best application of my public health degree, but I think it's short, concise, informational. It gives you what you need to know in order to understand the way that I generally talk about things. And I really hope to continue along this journey with you. I hope you continue to watch, subscribe, grow with me. Yeah, thank you so much. My name is Brooke, and hopefully you'll see me soon. Bye.